So, what do you guys know about nutrition?
Fuels the body.
It fuels the body. What else?
Carbohydrates are for energy.
Carbohydrates are for energy.
Or source of energy, sorry.
Body uses glucose.
Body utilizes glucose.
Protein helps the healing process.
Protein helps the healing process. Perfect.
All in moderation.
Yes, that's the tricky part right there. Moderation.
Sorry, no, sorry.
Is this okay for sound?
Yeah.
Yeah, it's good.
All right. There is a lot to nutrition, and I will say that typically in the past, students have not paid too much attention or kind of wrote off nutrition. That will be a mistake. Okay? Nutrition is very important. What we don't like to hear as Americans, we want something fast to fix whatever's wrong with us, right? But do we want to eat healthy? I think I said it in labs last week, we're supposed to drink how much water? 2 to 3 liters a day, but it's so hard to drink that much, but we have no problem downing, 8 or 12 shots in one night. Okay? Yes, sir.
I feel like nutrition, if you have good nutrition and lifestyle, it prevents a lot of health issues.
It can. It can. If you have a high sodium diet, you're looking at possibility of hypertension, coronary artery disease, stroke, diabetes even. Okay? So it has a tendency to play a key role in everything. But we're lazy Americans. We don't want to hear that. We want, well, what pill can I take to get rid of this? So we don't like the long-term goal or thing. So you do need to be aware of the 3 things: carbs, fats, and proteins. We're going to touch a little bit on vitamins and minerals. The 2 that I'm really going to kind of really ram home at this point are going to be potassium and sodium. When we get into fluid and electrolytes, I'll elaborate on those a little bit more, but then we'll be adding magnesium and calcium. Okay? There is a website called Choose My Plate. Have you guys heard of this?
Yes.
MyPlate.gov. Actually, it's a really good website. I have a QR code on this for you guys to scan if you want to look through it. Different parts of the lifespan. So our patient's age is going to play a role in what types of nutrition is going to be the most important. Infants typically will require more fat than adults. Why?
Because they
It actually comes to neuro tissue, to brain tissue formation. Okay, that brown tissue at the bottom of the skull back here getting formed. So they need the higher fat diets. You don't want to give your baby, 1% milk. Give them cream if you want, because that's going to help them more so in the long run. Okay. Now, we all know that BMI is not an accurate way to tell if somebody is obese or whatnot, but it does give us an idea. Okay, we do need to know what the body surface area is. Pharmacy more so, because they do calculations to figure a lot of things out. And they need at least a height and a weight so that they can figure those things and know if the medications that our patients are receiving are helpful or hindering. We talked a little bit last week about cultural influences, special diets. We kind of touched a little bit on yesterday in lab. So what are some of the special diets? And don't say keto or Atkins or South Beach.
Mediterranean.
Therapeutic diets though. Cardiac, what was yours, Jesse?
Oh, I said liquid.
Liquid?
Mhm.
Yeah, there's 2 kinds of liquid diets. What are they?
Clear.
Clear and
With a double C.
full. Full. Okay. Clear liquid. Well, liquid is anything that is in a liquid form at room temperature. That's why pudding, custard, those don't count. They may be part of a full liquid diet because you can't see through them, but they don't count as a liquid. Okay. Clear liquids are anything that you can see through. So grape is kind of right there. Some people say grape is, some people say grape juice is not. But I say, it depends. It was like cran apple or what, apple grape juice or whatnot. It's a little thinner, so you can see through that. But anyway, apple juice is definitely clear. Milk,
Not clear.
not clear. That'd be on a full liquid diet. Okay, creamed soups even. All right, and then assisting clients with feeding. You guys will be doing a lot of that, especially during this semester in the long-term care facilities. They'll probably have you feed somebody on your first or second day. Okay? What do we need to use when we're feeding somebody else? What utensil? Spoon. Why? It's not sharp. We don't want to stab their gums if we can avoid it. Okay? So here's a little video about some of the, what's called a BMP. Do you guys know what that is? Basic metabolic panel. It gives us an idea, lab value wise, of quite a few different lab values that we need to keep in mind.
Hello nurses, this is Kevin with the Nurses Notes, and I'm going to talk to you about the Basic Metabolic Panel, or Chemistry 7, from the blood book, The Labs You Should Know. It starts with this fishbone, a diagram, like this. It's a methodical way to look at the labs and to see major electrolytes. It's also called the Chemistry 7. So why is it drawn? Well, all patients in the hospitals get blood work on a mission to establish some sort of baseline. To understand more about the patient's changing conditions, it might also be drawn. So all patients should have a BMP, and it includes lab values, like sodium, potassium, chloride, CO2, bicarb, BUN, creatinine, and glucose. This is the BMP, or Chemistry 7. Called that for the 7 items in the panel. So blood is drawn from the patient and then it's sent to the lab where it gets spun into a centrifuge. This separates the blood into formed elements like red blood cells, or white blood cells, and platelets, and plasma, or the fluid portion of the blood. I like to think 55-inch plasma TV, then I know where to go from, so RBCs will be 45% and 1% of your WBCs, which makes sense since the patient doesn't have a fever, so this should be less than the volume of blood. And the RBCs and the WBCs together equals another fishbone called the CBC, which is covered in another lecture. So we're going to go over the BMP, and what we're really measuring is these electrolytes. And these electrolytes are all in the plasma. And this is an interesting concept when you're trying to assess our patient's labs, since anything that's going to affect our fluids will affect the plasma, like vomiting, diarrhea, fluid loss, and even procedures that take fluid out, like an NG tube or an OG tube. In our first column, we have sodium, and that's outside the cell, and sodium loves water, and high is dry, or dehydration. Since they don't have the fluid on board, the sodium is concentrated, and high is dry. And we often can see our assessment showing us that this patient is dehydrated. So sodium's outside the cell, and low is acute. It's acute since we don't know where the fluid is, and this requires further assessment. Since the patient is at risk for coma and seizures, we never bolus sodium, and we only raise 1 milliequivalent an hour, since the brain can't handle these fluid shifts, and they could herniate. Remember, sodium follows water, and in a closed environment, that's dangerous. So let's review. High is dry and chronic because we monitor and we treat accordingly. And low is acute since we don't know where the fluid is, and this patient requires a further on assessment. They're both at risk for fluid shifts and both could go into a coma or have seizures. And we never raise more than 1 milliequivalent an hour. In our next section, we have potassium, or K, inside the cell, kin to the cell. But remember plasma? There's very little in the plasma, and that's why it's so important to keep it regulated. And both are acute. Low is acute and usually is a result of fluid loss like GI, diarrhea, diuretics like Lasix. And this is acute since it causes muscle weakness, decreased reflexes, and potentially respiratory arrest. Next, potassium high. This is acute. Why? Well, remember plasma, and it's in the plasma, but it can't get out. And this is usually related to kidneys, since the kidneys are responsible for removing potassium, and injury, acute or chronic, this isn't happening. Also, in burns, as cells get damaged, potassium spills into the plasma, causing hyperkalemia. These patients need to be on a monitor, and we need to do things to get it out, like give Kayexalate that pulls the potassium into the intestines, or insulin and glucose, which work together in forcing the potassium out of the plasma and into the cell. And lastly, if the kidneys are working, we can give diuretics like Lasix. Okay, let's review. Potassium is a major ion inside the cell, but we're truly measuring what the potassium is in the plasma. High or low, both are acute, and they should be on a monitor. And we're looking for ECG changes. Low is usually because of fluid loss, like in the GI tract, either through NG tubes, diuretics, vomiting, or diarrhea. We need to replace potassium immediately, but we never ever bolus. And we only give 20 milliequivalents an hour. This patient should be assessed for weakness and ultimately potentially respiratory arrest. High is usually related to renal disease and that it can't get out of the body. And these patients need to be assessed for ECG changes like peak T waves and ultimately potentially cardiac arrest. So we need to get this potassium off as quickly as possible. They might need dialysis, or we give meds like Kayexalate, glucose, or insulin, or diuretics like Lasix if the kidneys are functioning. Next, we're going to talk about chloride and CO2 or bicarb.
Okay. Now, if you would like, you can watch the rest of this video, but I just really want to concentrate with you guys on the sodium and the potassium. Now, why do you think that those two are the most important of the electrolytes?
Our neurons need it.
Say it again?
Our neurons need it.
Our neurons need it for one. What else? It controls the cardiac cycle, and it also helps with muscle. Remember in A&P, that sodium potassium pump?
Yeah.
The exchange of ions to get the energy. That's why people who have either low or high values of these can suffer from fatigue. They don't have the energy going on, okay? If they have too much potassium, their heart rate can go to a point to where it's so fast that it actually goes beep, because it's not having the time to reset with that conductivity, okay? Same thing with sodium. How fast did they say that you replace sodium? No more than 1 milliequivalent an hour, okay? And it talked about herniation. What happens with sodium, again, they mentioned that what follows sodium? Water, okay? If you give your patient too much sodium too quickly, that water is going to shift and typically causes cerebral edema, which makes the brain swell, and then if it swells too much, too quickly, it can herniate and come out the foramen magna of the skull. Okay? So very important things to remember there. Now this is just a basic chemistry or Chem 7. They do have one that's called a CMP or a Chem 12. It just has more things in it that they're looking for. Okay? All right. So here is this lovely thing for the MyPlate. Okay? This also helps people to understand what their food is doing for them. Now, one of the things that's been really detrimental here in the United States is a lack of nutrition classes in schools. Okay? How many of you guys know what a single serving of salad dressing is?
Isn't it like 3 tablespoons?
Depends.
The standard serving of salad dressing is 1 tablespoon.
Mine says 2.
Okay? 2 ladles.
What is it?
1 tablespoon. Now, how big are the ladles at most restaurants or salad bars?
2 or 3.
They're more like a 1/4 cup,
What are ladles?
which is 4 ladle.
Oh, okay.
Yeah. Yeah, okay. What about a serving of fat? Like butter or cream cheese or something like that.
I think it's 3.
It's about the size of a dice. And I don't mean the D20 dice. It's like this big for you D&D fans out there, okay? little 6-sided dice. A serving of bread. Bread. One slice. Okay, and that's now, are all breads created equal? No, because some are smaller. But so the general idea is about the size of a CD case. Most of you don't probably know what that is. Okay, but about 4 by 4. That's considered a serving of bread. What about a serving of meat? Whether it's chicken, fish, it's 3 ounces, which is about the size of the palm of your hand or a standard deck of cards. Okay. Now, last time you had a burger, I'm jealous already. Okay. How big was the patty?
It's pretty big.
Most of them say oh, this is 1/4 pound, right? Which means what?
It was way before.
Huh? That's way before. Correct. Okay.
Means it's-
But what's a 1/4 pound?
Too fucking much. I mean, too much. I mean,
Unhealthy. I mean.
unhealthy.
A 1/4 pound is 4 ounces. So typically a 1/4 pound hamburger has 1 serving of meat on it. Okay? What if you get a 1/4 pounder with cheese? Or a double 1/4 pounder? Or a Big Mac?
I don't like it.
Okay, that's all gonna affect the amount that you're taking in. How many servings of meat are we supposed to have a day? 3 to 4. So if you go out to dinner with your friends and you get a 9-ounce steak, that is all 3 servings in that one meal. Okay, we don't know about serving sizes. And the sad thing is, they've changed over the years. I remember when a large McDonald's drink was the size of Sheila's water cup there. That was a large at McDonald's when I was a kid. Okay, how big is a large now? It's like a freaking gallon. Oh, this is kid size because it's the size of a small child. Well, yeah, okay. So we as nurses, we need to be aware of these things, okay? Because guess who isn't?
Our patient.
Our patients aren't, okay? And just so you know, a serving size of vegetables is about the size of a standard light bulb. And let's see, what was the other one? Well, no, when I was teaching at the high school and went over this, they had this box of different everyday objects that you can compare a serving size to. And it was really, I tried to find it to get it here, but I think they don't make it anymore, unfortunately. So, good nutrition obviously is essential to wellness. We don't want to have too much salt, we don't want to have too much fat, we don't want to have too much of anything. Although, lots of times we typically overindulge, because chocolate is actually good for you. Huh? Well, raw chocolate is actually best for you before it's been processed. It's actually an anti-inflammatory, believe it or not. Okay. Now, everyone familiar with this? I have to admit, over the last year, I've gotten way more familiar with these things. Okay. These are based off of all these numbers over here for the daily value. That's if you are consuming or trying to consume a 2,000 calorie a day diet. Okay. Any of you guys in group 1 yesterday found out how hard is that? It's very easy to go way over 2,000 calories a day, given our fast food diet here in the States. Okay.
Over 2,000.
I think last time I pulled through Burger King and got an Impossible, yes, it was an Impossible burger. I think it was like 600 calories. Just for the Impossible burger, not including my drink. I didn't get fries because I don't do anything fried anymore. Okay, so these are the ones that we want to limit. Okay, the fat, the total fat, the saturated fat. The saturated fat's worse because that's what clogs up the arteries. So this is what I have to be very careful and watch. And how much are you allowed to have a day in saturated fat? I know Group 1 knows. The American Heart Association recommends no more than 13 grams of saturated fat in a day. Okay. Cholesterol is another one, sodium. Dietary fiber, it's almost like you can eat as many of this as you want when it comes to fiber. because that's going to help clean you out and get everything going and moving, all right? Now, there are two sets of vitamins that you need to be very familiar with. One is your fat-soluble vitamins. Anybody know what those are?
Is it a K or is it
A, D, E, and K. Those 4 vitamins our body will store, and we can actually have too much of that. Okay? Then we have the water-soluble vitamins, which are vitamins B, C, well, actually it's C and the B complexes. Okay, those are the ones that we need to intake every day because our body does not store them. When we drink water and everything, it kind of flushes out the excess. Now, it'd be very difficult to overdose on those. Can you? Yes. But very difficult because, you know, you get thirsty, you drink water, and it comes out when you go to the bathroom, okay?
So, which ones are the water soluble ones?
Those are your vitamin C and B complexes. The fat soluble are A, D, E, and K.
Okay.
Okay. We all know how energy nutrients go into the body, okay? There are 2 different ones that we need to be familiar with. Your macronutrients, which is your carbs, your protein, and lipids, or fats. We do need fat in our diet, otherwise our nerves do not conduct the nerve impulse adequately, so there is a small amount of fat that we do need, okay? When people say, oh, well, they got like type 2% body fat, I'm like, okay, but how's everything working for you with that? Okay. Then we have the micronutrients. These are the ones that manufacture, repair, and help to maintain cells. They don't necessarily provide any type of energy, but they do help with maintenance, if you will. Okay. So carbs, my favorite. Gotta love a good carb. Okay. They give almost all of the energy that the brain needs. Okay, we run basically on Dunkin', no, just kidding. But basically on sugar. Okay, glucose, all those fun things. What's hard for a lot of people to understand is that there are good carbs and bad carbs. The good carbs are the ones that take a long time for the body to break down to provide that energy. Those are your complex carbs. Then we have the simple sugars, or simple carbs. So granulated sugar is actually a simple carb, okay? What about honey? Would that be a simple or a complex? It's actually simple, because it's pretty sugary, okay? Your complex carbs are gonna be like your breads, your whole wheat bread, I should say. White bread, because it's so processed, is not, that's gonna be more of a simple carb. Okay, but whole wheat bread, whole wheat crackers, grains, things along those lines.
Those are
Oatmeal,
complex or simple?
those are complex. The ones that take a little bit longer for your body to break down are going to be complex. So, and that comes into play later when we talk about diabetics and controlling their blood sugars. Because simple sugars are like, just think about candy. You get a real big sugar high, right, when you were a kid, and then what happens? Boom, you crash, right? Because your body breaks it down really quick, gives you that little bit of spike in energy, and then it runs out because it's not gonna last very long, and it goes away. Complex carbs, however, like the whole grains and things, it takes a while for that energy to get up there, and it gets there, and it hangs out for a little bit, and then it slowly comes back down, okay? So,
I have a question. Should
Sure.
we know which foods contain simple carbs versus complex carbs?
I would
Or-
have a general idea, yeah.
Oh, okay. So like, okay.
All right. If no carbs are available within the system, protein and fats can be used for energy. So the first thing it's going to do is your body's going to try to break down the carbohydrates, because that's its first, not first defense, but first round access to energy, okay? People who are anorexic, who don't eat anything, typically once their body fat has been utilized and broken down and everything, what's the next thing that the body does to get the energy it needs? It breaks down the body's muscles to get it, because that is where the protein is, okay? Because it needs the energy. Our bodies, I mean, yeah, we get rest and stuff, but our bodies are working 24/7. Okay? So, now proteins are good. These come from meat, fish, certain beans. That's why, you know. Okay? Or what's the other term that we can use for beans, for protein sources? Legumes. Okay? They do, of course, protein's main function, along with not necessarily first being energy, but it does provide that, but it helps with tissue healing, wound healing. Okay? We need to have a certain amount of protein every day, because even though we might be in good health, there's damage being done to our body, and our body's in a constant state of rebuilding. Okay? So we always need to make sure that we're getting that. The most complex amino acid, do you guys know what food combination is like the best for you? It's something super simple.
Are you talking about like when we eat the food, like what
Mhm.
order to eat it in?
Well, no, just that there's a combining of these two foods that is like the best thing for you. Depending on how it's made, it can be altered, but ultimately these two things are the best combination for you. They create a complete amino acid.
Almonds and vegetable oil.
No,
Aren't eggs like the most complete food?
eggs? No,
Eggs?
they are high in, they are high
Oh,
in cholesterol.
potatoes and butter.
No.
Dang it.
I'm surprised my Hispanic friends aren't saying anything. Oh, I didn't hear you. Beans and rice.
Ah, I was gonna guess.
Beans and rice. Now,
Tacos.
not refried beans, because that's made with a lot of oil, sometimes lard, and lots of cheese and everything, so that's higher in fat. But whole beans, pinto beans, black beans are the best, and rice is actually the best combination for you. I apologize to your partners in advance, though.
Does it
Alright.
matter what type of rice, like white or brown or?
Preferably brown, because that's considered more of a whole grain, whereas white usually isn't much so. It's kind of, diabetics are encouraged instead of eating white rice because it's been processed, whereas regular brown rice has not. The only thing I've ever tried that I was like, oh my god, I will never eat this again, and it's in the rice grain family, farro. Have you guys ever tried that? It's disgusting. Ugh.
Farro mac and cheese that is like so delicious.
Ugh.
Sounds feral.
Farro. It's a type of grain, and it looks like it like sticks to itself. So kind of, if you've ever made Rice Krispie treats, you know how you, with the
Farro.
marshmallow, it kind of stretches with between the Krispies. That's what farro looks like after it's been cooked, and it's just no. Sorry, if you enjoy it, that's fine. Not my jam.
Hold on.
Okay.
If I were to pull up an image of it, could you tell me what it is? Is it any of these?
All those brown things in there. Yeah. I mean, I'm all for trying different types of foods and stuff. Hence the reason I tried it, but nope, not for me. All right, lipids. We do need these again for brain and nerve function. Okay. Think of lipids almost as like, even for joint health. You know what I mean? We need to have that lubrication for our joints to move around. We even need to have lubrication when we're going to the bathroom. Imagine how, I mean, if you've ever had to go to the bathroom and you've had to like pass a very hard stool, you know the discomfort that is. If you don't have enough fluids in your system and enough fats, it's even worse. Okay, like sandpaper. Back up, yeah. Now this is the last one that the body will try to go for, as far as breaking down body tissues for energy, is the lipids. Okay, they're stored longer. That's why they're hard to get rid of. Okay, when you're basically born, you have all the fat cells in your body when you're born, but it's just the size of the cell itself that changes. So you could never be, you know, I think that's one of the reasons why you're never able to get as thin as you were in high school, which I'm like, damn, I wish. Okay, now as far as lipids are concerned, there's not just one lipid for all things. Okay, We have monounsaturated, polyunsaturated, saturated, trans fat, and dietary cholesterol. All right. The main thing is that saturated fats typically come from animal-sourced proteins. So steak. Chicken has a little bit of saturated fat in it, but not as much as red meat. Okay. Your unsaturated fats are pretty much all, with the exception of fish, okay, but they're pretty much all plant-based. These are the good ones, okay? Now, when it comes to cholesterol, what's the difference between low-density lipids and high-density lipids?
One's higher, one's lower.
No, one is the good cholesterol, the other one is the bad.
Correct. Now, which is which, though?
I think LDL is the.
L is bad, low density, because that's the one that can change its shape and get stuck in places and cause an occlusion in an artery, okay? Whereas high density is more like a basketball and it bounces all over the place, but it very rarely, you have to have several of those amongst a bunch of the lower density lipids to kind of get stuck together and create a blockage, okay? All right, proteins, we talked about that. So yeah, lipids, that's one of the things I'm really watching. I have actually, like I said earlier, I've almost gone completely plant-based. Like I'll have chicken and turkey and fish, nothing fried because of the trans fats and stuff in that. But red meat, pork even I haven't done. And I used to like lamb too, but I can't have that either because that's considered red meat. So yeah, until my cholesterol gets to where it needs to be, I'm like, believe me, I would love to have a steak right now. Okay, so our micronutrients are vitamins, minerals, and trace elements, okay? Vitamins are very important, especially for moms, okay? If you're of the age of trying to get pregnant or think you might become pregnant, it is very important for like, even for like the first, I want to say 4 to 6 weeks beforehand, that your vitamins are checked. Because if you are deficient, it increases your chances of your babies having complications. For instance, now that looks like an apple on the poor kid's back, and I think that's what it is, but it's supposed to be spina bifida, okay? Spina bifida is where the neurotube that normally is housed in the spinal column actually has an outpouching. And these nerves from this point on are damaged because they're usually pinched. And these kids usually are born paralyzed from the waist down, or from wherever the outpouching is down. Okay. There are also other neurotube deficits that can happen from not having enough vitamin C, other amino acids and things like that. That's why prenatal vitamins are high in like folic acid and B vitamins and things like that. Okay. Okay, so we talked about the fat soluble ones, okay, and the water soluble. Okay, minerals are your calcium, iron, and then of course potassium, sodium, magnesium, and zinc, okay? We need the iron because it helps with red blood cell formation. Not hemoglobin, not hematocrit, just the red blood cells overall, okay? Because hemoglobin does what? It helps transport oxygen and carbon dioxide throughout the system, okay? But we can't have hemoglobin and hematocrit without red blood cells. And that's what the iron is going to help our body build, is more red blood cells. Any idea how long your red blood cells last for?
14 days.
About 3 weeks. Okay, and then they are broken down and utilized and turned into platelets. Or, where do they get excreted from? No, not your period. Because Men don't have a period.
I mean,
Well, I mean, we have a man period, but definitely not a menstrual cycle. It comes out in your stool. That's why your stool's brown. One of the reasons why it's brown. Because when your body breaks down iron, so, little tidbit. The shit you never knew. All right, calcium, we need that for healthy teeth, because that's bone, and of course bones as well, okay? Ladies, when do you typically need to have more calcium? During menopause, for sure, because typically after menopause has done its course and everything, your body has a harder time absorbing calcium, which leads to osteoporosis, okay? All right, water makes up about half of the total body weight of a person, depending. For men, it's about 55 to 65%. For women, it's about 50 to 55%, okay? Keeps the body to transport substances, helps our body to stay nice and cool, believe it or not, because what do we do when we get warm? We sweat, and we lose heat when we're wet. So that's why when you're sweaty and a breeze goes by, what happens? You get a little chill down your spine, don't you? Okay, because you're losing heat. Anyway, do you know how much your body has as far as what's called insatiable loss? A loss of amount of fluid that you cannot do anything about because it's evaporating off your body. You could stay indoors all day, but your body's still going to produce some sweat to keep it the temperature regulated, about 400 milliliters a day. So about 2 cups a day of fluid comes off your body at evaporation. Everyone's like, yeah. And then if you go to the gym,
did you say 400 milliliters?
about 400 milliliters, yep. Okay. Should we take a break? I see some people needing one. All right, 10 minutes. Because some people are like,